from the California Institute for Behavioral Health Solutions with Mike Geiss once again to do the Small County Fiscal TA webinar. By now, I think you all know the drill. You're on mute. If you have questions, type them in the question box or click the hand next to your name, and then I'll take you off mute. And this will be recorded, so within the next couple of days I'll be sending out the link so that you can share it with other people who weren't able to attend. And that's about it. Let's just have Mike start.
Okay, thank you, Shoshana. Good afternoon. What we're going to cover today is what was discussed at last Thursday's Financial Services Committee meeting, and it's got the list of our usual topics that we cover. And so diving right in with MHSA, and there really wasn't much to talk about there, but the state does still intend to release their fiscal year 12-13 MHSA revenue and expenditure report template, hopefully within the next week or so. And now they've moved the due date back. Originally it was due December, then they moved it back to the end of January. Now they're giving you another 3 weeks till February 20th, has what they've indicated. They've also been pretty flexible with us in the past, and I think that the February 20th date assumes that they get the info notice and template out by December 20th, because they do like to give you a full 2 months to complete it. So if for some reason they don't get the template and info notice out, I would expect that date would be moved back as well. But at this point they're saying February 20th. So go ahead and hopefully plan on getting that into your schedule. And I know folks will be doing budgets right around that time as well. So hopefully it won't be too difficult to complete. We talked a little bit about the Short-Doyle modernization update. As we talked about last time, there is a draft project management plan that has been published, and there's really 3 parts to that. 2 of those are short-term, and 1 of those is a longer-term activity. So the main short-term one from a fiscal perspective is this federal reimbursement pilot study, where we'll be looking for probably 6 counties to test the use of some sort of prospective payment system as the form of reimbursement under Medi-Cal, especially mental health system. And in terms of the prospective payment systems we'll probably be looking at would be either an encounter-based system similar to FQHC's, or we might look at case rates, or we might look at capitation, or I should say we'll look at all 3 as part of this process. The goal of this federal reimbursement study is to have, probably by the end of next June, June 2015, some sort of proposed approach for a new reimbursement methodology for Medi-Cal, especially mental health services. Hopefully if we have something by then pretty concretely, then vendors can start to prepare and counties can start to prepare for implementation of such an approach in fiscal year 16-17. So hopefully that will work out in terms of the time frame. The other short-term part of this Short-Doyle modernization project is enhancements to Short-Doyle 2. We didn't talk about those in too much detail, but they're listed in the project management plan. I think one of the main ones deals with trying to be able to reconcile your claims to your both your submitted claims to your approved claims, and developing some sort of enhancements that would allow you to do that. And then the last thing is kind of this long-range Medicaid information technology architecture planning, which really needs to be consistent with the federal reimbursement pilot study, and to where we can start to look at integrating behavioral health data with the rest of the healthcare world, rather than having these the standalone system that we have currently. Probably something you want to pay attention to is that there is a county-to-county teleconference with CBHDA in Cal Mesa, and that is next Monday, December 15th from 3 to 4. And so if you want information, you can contact Sarah right there, her email address, and she can let you know the call-in and everything else. So any questions on the Short-Doyle 2 or the Short-Doyle Modernization project? All right. Then we went into the Short-Doyle 2 updates with the state. And as we talked last time, there's $600,000 in state general fund monies that DHCS has in the current fiscal year to reimburse you for the costs of preparing the KDA quarterly progress reports. Originally, the discussion was that you would have to submit some sort of claim form similar to what you do with the Medi-Cal, especially mental health administrative claims, quarterly basis. But now they're looking at just doing an allocation rather than a cost-based approach. Last time, counties recommended using the same statistical basis for the $400,000 in state general fund that Department of Social Services has, just to be consistent. So there's about $1 million total in state general fund for the state to allocate. And last time the state had, I think the counties had recommended looking at some different alternative cohorts for allocating those funds, such as number of foster care children or the number of subclass members. But what the state reported out this last meeting was that they're considering just doing equal distributions to all counties, so everybody gets the same amount. With the under the premise that it's the same whether you're a large county or a small county to prepare the report. Doesn't matter how many services you've delivered. You still have to do the development and write the report. So if that occurs, then between the $600,000 in DHCS money and the $400,000 in social services money, it means each county would get around $17,000, which really is not that much money. So from a small county perspective, I hope that they do stick with the equal distributions to all counties, because if they do end up trying to do it on some sort of statistical basis, it may be where some counties, like we had with some of the drug Medi-Cal distributions, where you're getting $50 or $100, which obviously isn't enough to cover the costs of developing a report, a quarterly progress report, because there are some fixed costs associated with doing that. So anyway, more to come on that, but I think at this point this sounded like good news, at least for small counties, in terms of getting some of this funding. We talked, or we were informed a little, that the KDA indicator information notice should be published by the middle of January. And this is where you're going to want the client indicator based on the class members would be on all services, not just the two that are identified as KDA services. And this will, at this point, it sounded like it's the KDA folks that are reviewing the information notice, not the DHCS folks who are at the meeting. The DHCS folks at the meeting indicated that there really were no changes over what counties are currently doing, or what has been requested of counties to this point. So hopefully, again, that stays the same. The other part of this is that as the state produces reports, if you as a county have different information, you're going to want to report back to the state that your information is different and what that information looks like. And I believe that would probably go to the MedCCC folks. And as we were also informed, or hopefully you're aware, the whole KDA settlement process was under what's called a special master, and there were reports that had to go back to that special master based on everybody agreeing to the process and to what would be reported and the objectives. And as of, I believe it's the end of this month, there will no longer be the special master involved, and so the relationship will purely be between DHCS and the counties, and so that's a good thing. And then we started getting into this whole adjudication of claims with multiple aid codes. And as we've discussed before, the Short-Doyle system does not adjudicate claims at the highest paying aid code. And so there are some proposed fixes that would allow the system to do that. But the one thing that was new this time was that we were told it may take up to 6 months to fix this problem. Where that is really an issue is on the folks that the newly eligibles that are eligible for 100%, you're eligible to get 100% FFP reimbursement, because if somehow they end up with a different aid code and it's getting adjudicated at a different aid code, you may not be getting 100% of the FFP. Obviously, this has a big impact on cost settlement and audit, so it needs to be corrected. And again, the Med-CCC folks are working with each county to identify the scope of the issue. It does cover more than just potentially the ACA folks that became eligible in January 2014, because we did have some other aid codes historically that were reimbursed at 65% that may have been being adjudicated at 50%. The state's not sure how far back this goes, but in any case, it definitely sounds like it will be a huge issue with the ACA folks potentially, and so you're going to want to pay attention to that as you look through your payments and as you prepare your cost report. So any questions on any of that stuff? All right. Some other updates. The electronic funds transfer process is still in testing, so they're not ready to roll that out yet. And then we got into the really big issue, which is this whole problem associated with the netting and void process that was implemented this past July. Apparently, and again, I'm not super familiar with the problem, so I might get some of the technical issues wrong. But the general concept is that I don't believe the Short-Doyle system can talk to the USL accounting system, and so as a result, you don't get paid. And it's primarily around or only impacting the 837I claim submissions. And it has to do with number of, I think the number of characters or data fields or something in the USL systems less than the Short-Doyle system, and so they can't talk to each other. But the bottom line is you're not getting paid FFP. The state does and has identified a fix for the problem, but they don't have a contract with the USL vendor, and so they need to get a contract to be able to do the fix, and then to get you guys paid. This apparently, again, is impacting all 837I claims submitted after July 1st, after the implementation of the netting and void process. Even if the services were provided, the data service was a prior fiscal year. So obviously, if you're trying to use approved claims data to complete your 1314 cost report, this is going to impact that, because you're not going to have as much approved claims data to complete your cost report. Although, again, knowing that you're just submitting an interim or initial cost report and that you'll still have a chance to update that later is good, but this obviously will impact at least your initial submission. So, and we spent a lot of time talking about that. There's a bunch of technical issues and other things associated with it, but again, it just demonstrates why this whole Short-Doyle system and these processes, really we need to move away from them. We really need to focus on developing a different reimbursement approach that doesn't link the adjudication of a behavioral health specific claim with your reimbursement, and hopefully we can do that through this Short-Doyle Short-Doyle modernization project. So anyway, we also talked a little bit about ICD-10, and DHS did indicate that they are continuing to move forward for the planned implementation of ICD-10 on October 1st, 2015. They're hoping to have the information notice out in the next couple of weeks. It sounded like they also have a readiness assessment survey that they're going to give you, just to kind of find out where counties are in terms of being ready for the switch over to ICD-10. The good news is too that they're going to switch over to DSM-5 at the same time, so it's just one change at that point. It was brought up that the Title IX, the California Code of Regulations Title IX, need to be updated because that specifies which codes constitute specialty mental health, or actually I think what it says is which codes are not mental health or Medi-Cal specialty mental health. And so since there are some changes, that will have to be updated. The other thing is that you don't want to implement prior to October 1st. You may be getting some pressure from your contractors to implement early, but the state will not be able to handle a claim for dates of service prior to October 1st, 2015. And so that was pretty much it for the Short-Doyle 2 update. Any questions or anything else? All right, moving on to the claims payment update. Apparently all but one county has been able to complete the reconciliation process on the 910 cost reports, so that's a good thing. The 1011 cost report settlement, the state has sent letters to counties who, when the county has a complete cost report, in other words, doesn't have any errors in the cost report, they've sent settlement letters out to those counties, and it sounded like there were quite a few counties who had not received that letter yet. So if you have not received it, then you're going to want to follow up with your analyst at the state in terms of where that cost settlement letter is. So they've sent the letters out, and so you've got, I believe it's 90 days to complete the reconciliation process. But the state doesn't have the appropriation, at least on the state general fund side, to pay out any funds, and so settlement won't occur until the beginning of next fiscal year in 15-16. And then we talked a little bit about the 11-12 cost report settlement, because obviously we're kind of hoping that the state would start to catch up here pretty soon. But they don't even anticipate sending out the cost settlement letters until the summer of 2015. And it sounded like maybe, if we're lucky, we would get actual settlement payments towards the end of 15-16, or it may not happen until 16-17. And then hopefully you're either finished or working on your 13-14 cost report, which is due at the end of this month. They put out the information notice 14039 that specifies their cost report policy. It was brought up that so the templates had been posted, and it was brought up that the summary cost report template had some errors in it, the initial one. I didn't have a chance to check whether they had posted a new summary template yet that was fixed, but just be aware that the initial one, the summary did not work correctly. One thing that's not in the information notice on the cost report policy, but is in some of the KDA stuff, is that they expect you to report the KDA services separately using the Mode 15 service function codes 7 and 57. So be aware of that as you're preparing the cost report. And then we talked a little bit about the Medi-Cal aid code master chart, which should be used to identify the category of reimbursement, because now we have more categories as a result of the Affordable Care Act. This is a link to the aid code master chart, which looks like this on your screen. And it does talk about which aid codes are reimbursed at the 100% level. And then you can go through and look at, as you go through this, these are the changes, but then it does break it out by category into whether it's a regular FFP aid code, which would be just put in your normal Short-Doyle Medi-Cal services, or if it ends up being the pregnancy or one of the enhanced or those aid codes, because you should really be using your aid codes in your services to decide which category to classify it. It was brought up that aid code master chart does not really, there is no crosswalk between that and the cost report. In fact, they both use kind of different nomenclature. So it was requested that the state in that aid code master chart list potentially add a column that says, cost report category, and to make it really clear to both the counties preparing the cost report as well as the auditors when they come out to audit the cost report, which category a given aid code should be reported on the cost report. Anybody have any questions on claims payment update? All right. We received a little bit of a drug Medi-Cal update, although there was no one from the state there to report out. But we're anticipating the same process for the Medicare Advantage plan claiming for drug Medi-Cal. So anytime somebody is enrolled in a Medicare Advantage plan, we anticipate that if that plan has provided the state a letter saying that they don't cover that service, you would not be required to get a denial from the plan prior to billing drug Medi-Cal. But we haven't seen that get published yet. The 1314 cost report update, again, my understanding is that they have not issued the cost report or the Paradox application, and that it's really a function that Paradox isn't really that well supported anymore. So the state's still trying to work through that. And so once they get the application issued, then they will provide a due date as to when the 1314 cost report is due. And then as we talked last time, you now have the ability to claim for county administrative costs following the form and the instructions to Information Notice 14-033. But we still don't have the ability to claim for UR or quality assurance costs yet. And then it was brought up last time that there's some concern about the impact on the SAP DMOE requirements as a result of the behavioral health subaccount allocations. But again, there was no one there to be able to discuss that. Anybody have any questions on any of the drug Medi-Cal? All right. So then we talked a little bit about the state, well, it's a state and federal budget update, but really we talked about the realignment funds, starting off with the behavioral health subaccount and the 1415 behavioral health subaccount allocation percentages. And what the state has said is that there are 3 components that are used to determine each individual county's 1415 allocation percentage. It starts off with your 1314 base allocations. It then actually, I should have probably reversed these next two, but they increase any drug Medi-Cal portion that's less than 100,000 up to 100,000. so that every county has a $100,000 minimum in their base allocation. They then add in the 12-13 growth allocations to come up with a total, basically a total allocation amount. They then divide that out, and that then becomes your percentage that's applied to the new 14-15 behavioral health sub-account allocation base, which is a little over $1 billion, as you'll see in the next couple of slides. The one thing is that this data that the state is using to determine the percentages does not equal the amount that will be distributed as the base for 14-15. But you can at least see how the state calculated each county's allocation percentage. The other thing is they did say they are going to publish an information notice on this that provides the detail behind the allocation percentages. And so once that comes out, it'll hopefully give you more clarity than just us discussing this. And kind of the reality is that if you were a county that had at least $100,000 in drug Medi-Cal in your initial base, as well as part of the 12-13 growth, you weren't one of the 7 or 8 counties that got a little bit more than the other counties because they were given the more funds to what the state said be made whole, your percentage is going to go down a little bit. But I don't think anybody went down enough to where you're going to receive less overall funding in 14-15 than you received as part of your 13-14 base. Then we talked a little bit about the 13-14 behavioral health sub-account growth. Again, we know that amount now. It's $60.1 million. And the state representative said that they anticipate using the same approach and the timing as what they did in fiscal year 12-13 with that growth, which would be relying on the 13-14 approved claim amount submitted through December 2014 to determine whether drug Medi-Cal and EPSDT were underfunded based on the 13-14 base allocations. For those counties that the state does determine were underfunded, they would get first priority on growth. Because of how, well, first of all, waiting till all the claims have been submitted through the end of this month, and being able to adjudicate the claims, although, again, given the problems that we talked about earlier with the whole Short-Doyle claim system, this may make this process even longer. But at least they anticipate at this point releasing those funds in May 2015. The other thing is, and I know there's at least one county, if not all of you counties, but based on those problems, that are going to have issues with their 13-14 claims. And so I would highly suggest contacting DHCS probably sometime after the first of the year, after you've known what you've submitted. And if you were unable to submit all your claims, you're going to want to contact the state, and we'll probably talk about that more at the February meeting. But again, the state's continued reliance on approved claims data, which again we say is incomplete and inaccurate, to figure out growth just doesn't make a lot of sense. But again, their goal is to try to provide counties the amount of funding that they would have received had this just been state general funded, in order to prevent them from what they believe is being sued for under reimbursement. So anyway. Then we talked a little bit about in this one-time allocation, there was a sales tax error that the state made where they didn't allocate the appropriate amount of sales tax to actually quite a few different funds, but more specifically for us, it was the 91 mental health realignment account and the 2011 realignment account that impact us. And so you should have received three warrants back right before or right after Thanksgiving to cover that one-time allocation. And then you should have also received a couple of checks for the 1991 mental health realignment growth for 13-14, which did actually, sales tax came in a little higher than anticipated, and so there was some realignment growth both in VLF and sales tax. And so here you can see, and we didn't go over these charts in the meeting, but just to give you an idea, so for the 1991 account, you should have received 5 checks in November, 1 for the growth in sales tax, 1 for the growth in VLF, 1 for the 5% of the support services account growth that comes over to 91 realignment, and then you would have received 2 checks for the error in the sales tax adjustment. One would have been pretty small, it was less than $300,000, and 1 for $10 million. So what should happen is that this growth that we received in the 91 account related to sales tax and vehicle license fees should increase our base in the current fiscal year, so that you should see an increase in base. Now, the one thing, as I said, that I'm a little concerned about is that the state hasn't published that new base schedule showing these 2 amounts as the base for mental health, and so hopefully that will happen soon. All of this is published on DHCS's, the State Controller's Office website. You go under state and local, and then apportionments, you end up here. The one-time sales tax adjustments up here. You click on that, and you can go through and see the remittance advice. Like I said, you received 1 for the mental health sales tax, 1 for the behavioral health sub-account, and 1 for the mental health sub-account. You can also see the mental health sub-account growth. So this is, again, the 5% that came over from the behavioral or from the support services account into 91 realignment. You can go here and see that for 13-14, see your share there. And then if you go to the health and welfare realignment allocation and look at 13-14, you can see the fiscal year growth. And again, you can see sales tax and VLF for mental health that you should have already received the checks, and the remittance advice is listed in there. When I keep talking about the base is 14-15, and this chart as of an hour ago had not been updated, subject to change pending the growth allocation. So hopefully that will get updated, and you're going to want to pay attention to that because it should reflect these higher amounts here that were distributed. Then on the behavioral health sub-account, again, the $60 million is now known, and it should increase the base to this $1,047.2 million. And so you should be able to look at your percentage of the behavioral health sub-account that you've been receiving, apply it against that figure, and that should be the base amount that you receive in 14-15 in the behavioral health sub-account. And again, we'll probably talk about this more in February. So that was kind of the state and federal budget update. Anybody have any questions on any of this stuff? All right. Moving along to the work group update. There was just a brief update. We're still waiting on this fiscal state plan amendment for Medi-Cal, especially mental health, that will allow you to get reimbursed above the SMA from January 1st, 2009 through the end of 11/12, when SMAs were eliminated beginning in 12/13. They're still working on submitting the state plan amendment and the request for additional information, or RAI, that CMS requires. And so hopefully that will happen soon, and the whole process will go fairly quickly once that gets accomplished, so that it will be hopefully a fairly simple process for those of you who exceeded SMAs, and potentially those of you who had published charges that limited your reimbursement, to where you will no longer, or even retrospectively, would no longer have to compare cost to charges. But again, more to come on that. Does anybody have any questions on the work group updates? All right, then we did the other fiscal issues. And here DHCS just pointed out, this was actually before we moved into county to county, but the state does have two information notices that were published back about a year ago. Information notice 13-20 and 13-21. 13-20 deals with claims submission timelines. But really, I think what they wanted to point out was that there is, in Information Notice 13-21, there's a claims appeal process, and apparently nobody's ever appealed any sort of claim. So the state just wanted to, I guess, make you aware that there is that process available to counties. We talked a little bit about the drug Medi-Cal administrative claiming. As I said before, you now have the ability to do that. The DHCS folks on the substance use disorder side put a 60-day requirement. So within 60 days following the close of the quarter, you're supposed to submit the quarterly claim. And if you don't do that, then basically you have to wait till the cost report to get reimbursed for your administrative costs. And again, the folks from DHCS who were at the meeting were more on the mental health side, and they were not sure why the drug Medi-Cal had this 60-day time frame, because on the specialty mental health side, you don't have any limit in terms of when you actually need to submit the claim for Medi-Cal specialty mental health administrative costs. So they'll probably, it sounded like they were hopefully going to talk, and maybe that 60-day timeline will be dropped, so that you don't have to, if you miss it, you don't have to wait till cost report to get reimbursed. Then we talked in county to county about the 4-county drug Medi-Cal pilot. And so what this is there are 4 counties who are doing some financial modeling as if they were under the 1115 waiver. And so basically what is being discussed or potentially proposed at this point is that under the 1115 waiver, you have the option to either opt in or not participate. But if you do decide to opt in, you could propose your own rates and your own coverage within kind of an upper target based on a projected per user per month cost based on your historical claims. And then you would have the ability to negotiate all of that, hopefully, with the state. And I say all of that meaning you could negotiate your rates or your reimbursement process, coverage, although there is some minimum, but also negotiate the state's projected per user per month. In terms of process, the 4 pilot counties have gone through and calculated some things and looked at some different things, and we're hoping, I think, to get back together soon and just have a conversation with CBHDA and the 4 pilot counties, and then after that, go ahead and discuss with DHCS what the counties found, and I think one thing that I believe probably all of the counties found is that to do the coverage that's being proposed and to pay rates that are appropriate, it's going to cost the state more money. So anyway, we'll see how receptive the state is to that. But then after that process kind of transpires, hopefully the 4 counties will be willing to share with the rest of you their experience, any sort of lessons learned, some of the key elements to look at in terms of structuring your programs, and then potentially even the negotiations with the state. So definitely more to come on that. In terms of the 1115 waiver, what we heard or what's being discussed is that the state probably cannot handle all counties opting in all at once, so it will probably be a phased-in sort of approach. The terms and conditions for the 1115 waiver have been posted. I haven't looked at them, but I don't think there's very much in terms of the fiscal provisions. And then as part of your application to participate, you'll have an implementation plan that will involve stakeholders and other folks. And so you will have a chance to structure, if you decide to opt in, structure your program consistent with what you want locally. There also has been, there will be an option, I believe, that for small counties to opt in regionally, acting together, rather than having each county have to do their own opt-in. So that was kind of it on the drug Medi-Cal pilot, and again, hopefully we'll have those counties come back and report to the rest of you maybe in February. And then we talked a little bit, again, just to make you aware, and I brought it up last time, that if you received, as part of your 8-9 EPSDT settlement, if that settlement payment came from the 11-12 AB 100 allocations, and you have audit findings recouping EPSDT funding, you're going to want to verify that the amount that the state is showing in your audit report as the amount of state general fund that they paid you is in fact correct, because that amount should just be the state general fund and not include the AB 100 payments, which are per statute not subject to audit or reconciliation. So again, anybody who received the reconciliation payment for 8-9 as part of that AB 100 distribution and had an 8-9 audit finding would want to verify that. And then, again, just so that you're aware, there is no meeting in January, just with the holidays and then with some of the welfare director meetings. There's no time for a meeting in January. And so our next meeting, I believe, is going to be February 4th. And following the Financial Services Committee meeting, we're going to go ahead and do a little budget workshop for small counties, beginning, I believe, at 1:30, assuming that we can get the Financial Services Committee on time and at 1 o'clock, and give folks a chance to go grab lunch and potentially bring it back. But yeah, we'll be going through if there's anything in the governor's budget, as well as probably talking more about the different realignment accounts, and again, hopefully working with you folks on the small county side, and as you look at how to structure your budget for 15-16. So
Mike,
that is it. Yeah.
It's actually February 6th.
Oh, I'm sorry. February 6th? Is that a Thursday?
Yeah. Oh, wait. Sorry. Looking at the wrong year. Never mind. The 5th.
The 5th. So there we go. Split the two. So
February 5th.
It's whatever,
at 1:30.
whatever the financial services meeting, which yes is February 5th. So anybody have any questions or on any of the stuff we've covered today? If not, you've probably heard me as well as the rest of us talk way too much over the last week with the Fiscal Institute, but again, that was well attended and hopefully beneficial for you as well.
There's a question about, will there be a sign-up on the training sent to the Financial Services Committee? And yes, I'll be sending out a flyer or a notice about it. You'll be able to register. We will also be having it be a webinar. So if you can't actually be here in person, we'll have the webinar available as well. But yes, I will be sending something out, and you'll be able to register soon.
But let me just clarify too, Shoshana, this is just for the small counties because we just want to deal with small county issues. So it will probably, I assume the flyer will just be sent to this group that receives this information, not the broader Financial Services Committee.
Right.
All right, is that it? Any other questions? If not, we'll end early.
Sorry, there is one hand raised. Suzanne. Suzanne, did you have a question? I think she's already asked her question. Okay, we're good.
All right. All right, well, thank you, and happy holidays to everyone, and we'll see you and talk to you next year. Thank you.
Thanks, Mike.
Bye-bye.